I have here is a wellness visit that actually turned into an interesting visit. So, which is why I did that. I know we were supposed to not necessarily pick a wellness visit, but we have ZE here. He's a 49-year-old white American male, born in 71. Patient came in, drove himself as a competent historian. He states he's here for his regular exam, and he states he doesn't have any issues. He's been feeling pretty good. So we go through the typical process there. Since there's no reason to be here other than the annual exam, I've listed the HPI's. Patient presents no issues. Past medical history, he does have high blood pressure and some back pain. Surgeries are none, hospitalization none. He did his COVID vaccines, so that was of interest, perhaps, how some people react differently with COVID. He doesn't really take much medicine. He does have some vitamins he takes. He does take one medicine, lisinopril, 20 milligram, once a day. The family history is relatively unremarkable in the sense that it, from what we ended up finding, did not seem to apply as much. But it did have high blood pressure, and his father did have a small stroke 5 years ago. That's the father, and then the mother, hypothyroidism, and she does deal with some psoriasis. So the father's history is somewhat applicable in what we found. So social history, he's a construction worker, so with my history and background in chiropractic, they beat their backs pretty badly. So we knew he might be dealing with some arthritis of the back when he mentioned some back pain that he has normally dealt with for years. He is divorced. He does have 2 children. He tries to go to church, but so there's not much support because he kind of feels out of place having a divorce. So I spoke to him for a second about that. That it'd still be good to go, perhaps, and get the stress off of him from the divorce, probably through church would be good. Maybe make some good relationships. He just minimal education with welding. Eats a pretty decent diet here. Meats and vegetables, fruits. Doesn't really like to go out to eat, is what he was stating. He does like to hike and play tennis. And so that's his workout because he's lifting so much in construction all the time. Sexual history, he says he's sexually active and uses protection. But he didn't really state a girlfriend relationship or anything, so I'm not sure exactly what he meant by all that. Chemical history, denies use of anything like tobacco. Does drink some beer on the weekend, maybe 3 or 4. Denies other substance uses like illegal drugs. Is a non-smoker again. On the review of systems, we got he denies any kind of weight changes or fevers or chills. He is clear visually, denies drainage or itchiness. Ear, nose, throat, mouth, denies ear pain, loss of smell or taste, or throat pain, problem swallowing. Denies chest pain in the cardiovascular area, or doesn't seem like he says he has any kind of fast heartbeat. Does state, though, he does get some puffiness some days recently in his legs. So that was definitely interesting. Pulmonary, he does state sometimes he's out of breath occasionally and denies coughing or spitting up blood. Gastrointestinal seemed to be okay, unremarkable on just about everything like gastrointestinal, musculoskeletal, other than the back pain occasionally. Skin, again, nothing unusual there. Neurologically, he doesn't seem to have any dizziness or muscle weakness. Endocrine-wise, no excessive thirst or urination, heightened cold intolerances, allergies, doesn't have that problem. Denies feelings of depression or suicidal ideation. So that was good to ask because of his divorce part. Objective findings in the vitals were all relatively normal. Blood pressure was up a little bit, 134/85, which, that's kind of more, that's just a tad bit too much high, but Temperature was good. Respiration to 18. SpO2 was 96. So he sat in a little bit low. And let's see what else we got here. We went ahead and ran some labs. So for his annual CBC, CMP, and of course the suspicion was here at this point that he was having puffiness in the legs, and he had a little bit of shortness of breath occasionally. So is this some kind of early asthma, or is this something to do with the heart, where he's just running out of breath a little bit? So to check that, we went ahead and added the BNP, a UA, went ahead and did a chest x-ray just in case, because you want to find these things. So this was the interesting part I found to be interesting. The office has the ECG unit, so it was easy to hook that up, and really didn't find much interesting there per se. The spirometry, so he was pretty normal. His FEC was, I think, was 90. That's what we found, and the echocardiogram was going to be recommended because the lungs didn't show anything, and the chest X-ray was negative. Maybe slightly enlarged, not much. So that, just really just wanted to proliferate that idea that, hey, we want to clear your heart of any kind of issues there. But anyway, moving on, I got ahead of myself. Physical exam is generally, in general, he's appearing in neat and clean, well-groomed, nourished, alert, and non-combative. Head, ear, eyes, nose, throat inspection is he was normal cephalic, good skin, hair, normal looking, eyes, at no ophthalmos noted, no blemishes, growths. The otoscope exam, the meatus was not, it had no erythema or growths, tympanic membrane intact, no and pearly gray, no bulging, no erythema. The nares septums were clear, no exudates or discharges. Oral mucosa was within normal limits there as well, under the gums and around the teeth, pink, without any issues there. In general, rest of the body, the integumentary system, no lesions, dry scales, or redness to speak of, just some various moles in different places there throughout the torso. Cardiac, no JVD present. Heart rate, less than generally abnormal, but higher than for the patient normal. So, that heart rate was at 87, so that's not considered abnormal, but he's usually in the lower or mid-upper 70s typically, so that's a good 10 to 15 higher than his typical. So I got 2 minutes left, I gotta hurry up. Let's see what else we found. S1, S2 were audible, no clicks, no murmurs. Rhythm seemed to be good, when we checked pulse and so forth. Pulmonary, relaxed breath sounds, no rhonchi, rubs, crackles, no auscultation, no fremitus noticed. Gastrointestinal, no visible scars on inspection. Auscultation, normal active bowel sounds in all 4 quadrants, and no masses. Liver and spleen not really palpable, and then no CVA tenderness noted. Genital urinary, external genitalia, again, no unusual problems here. Pubic hair and rashes, lesions, everything seemed to be within normal limits. Skin color was normal pigmentation there. Musculoskeletal, he had full range of motion in neck area. No excessive kyphosis, lordosis, or scoliotic curvature noted. Tender spinous is noted in the lumbar area, consistent with osteoarthritis is what I find typically. Neurologically, reflexes were intact, cranial nerves were intact, negative for depression. He didn't indicate that. So the differential assessment here, diagnosis, first one we ruled in here was the early stage heart failure due to this edema, leg edema, which would be graded mild, not very noticeable, and then but connected with the shortness of breath kind of had you a little bit curious on exertion. underlying high blood pressure issue, and of course borderline enlargement on chest x-ray, which you could argue either way, and a negative ECG. Just you know, put that into perspective there. Versus we wanted to rule out asthma, which we did because the spirometry was good, negative auscultation, and then early kidney failure. Perhaps he's holding fluid and the kidneys are not expelling correctly, which showed the BUN and the creatine levels were normal. We didn't get the BNP back yet. Let's see here, what else we got? Diagnostically, we already went through that. Therapeutic treatment plan was basically up to date, indicates that you'd want to put somebody who has minimal edema on a, let's say like a metoprolol, 12.5 milligram, and he already has the lisinopril, so beta blocker with an ACE inhibitor. That would take some of the strain of fluid out of the picture, off the heart, and of course reduces sodium intake. As far as home education, and referral to cardiologist for an opinion about this. Catching it early would save him a lot of headaches, I believe, in the future. I'm about a minute over. I'll try to hurry here. We got education left. We'd recommend that he take daily weights, because if he's starting to retain water, we'd want to know. We want to see that change. Blood pressure log, and then of course reduces intake of salt, as we mentioned. Maximum of 1 drink per day is what's recommended. Of course, no smoking, which he isn't. Daily cardio, such as a good fast-paced walk. And of course, for the cultural part of this assignment, in the rural mountain area, it's typical that they eat a lot of cultural food that's fried. I mean, it is a fried capital of the South, and it is very common. So a brief warning on that was given to him about, hey, you may not want to fry everything. Baking, broiling of sorts would be good. And of course, I recommended a visit to the American Association of Heart Failure Nurses Patient Education Portal, which I gave a link for that. Alternative approach in this is interesting because beets provide nitric oxide, which would dilate the blood vessel, which would help circulatory. And of course, CoQ10, and then prayer meditation for the stress reduction. Thank you for listening. We recommended a follow-up in 5 to 7 days for this fella, and of course we'd have the echocardiogram results, and in the BNP actually too. Thank you so much. I better stop. I'm over the limit.